Traditional Chinese medicine is indeed taught in university classrooms and lectures today. However, the nature of traditional Chinese medicine education is different from that of Western medicine. In Western medicine, the diagnostic approach is primarily based on measurements and quantifiable standards. Observations such as urine tests, blood tests, and other measurements are used to determine normal ranges for different components in the body. This diagnostic method can be universally learned in the classroom. On the other hand, traditional Chinese medicine diagnosis involves more than just measurements. It requires a deep understanding of the patient's overall condition, including their physical, mental, and emotional state. Pulse diagnosis, for example, is a crucial aspect of traditional Chinese medicine diagnosis that cannot be easily learned in a classroom setting. It requires years of practice and experience to accurately interpret the subtle nuances of the pulse. While traditional Chinese medicine education does involve studying textbooks and theoretical knowledge, the true essence of traditional Chinese medicine lies in clinical practice. This is where the transmission of tacit knowledge occurs. Tacit knowledge refers to knowledge that is difficult to express in words or language. It is acquired through hands-on experience, observation, and guidance from experienced practitioners. This experiential learning process is essential for traditional Chinese medicine practitioners to develop their diagnostic skills and treatment strategies. In summary, while university classrooms play a role in teaching traditional Chinese medicine theory, the mastery of traditional Chinese medicine diagnosis and treatment requires extensive clinical practice and the acquisition of tacit knowledge. Traditional Chinese medicine cannot be mass-produced in the same way as Western medicine due to its emphasis on individualized patient care and the need for experiential learning. There are two types of knowledge, one that can be explained using language and concepts, and another that can only be understood intuitively, without words or communication. In English, this second type of knowledge is called tacit knowledge. In traditional Chinese medicine, the diagnosis and treatment methods heavily rely on tacit knowledge. This raises the question of how to train traditional Chinese medicine practitioners. Should it be done through modern institutionalized education or through the traditional apprenticeship system? In my opinion, the apprenticeship system is the only way. It's not possible to mass-produce traditional Chinese medicine practitioners through university education. I've shared this viewpoint multiple times within the traditional Chinese medicine community, which has made some traditional Chinese medicine university presidents uncomfortable. They interpreted my stance as suggesting that traditional Chinese medicine universities should close down. I clarified that I don't advocate for shutting down universities, but rather for not relying solely on modern institutionalized teaching methods. We need authentic apprenticeship-based training to nurture generations of genuine traditional Chinese medicine practitioners. Without this teaching method, the tradition of traditional Chinese medicine will be lost. The imminent decline of traditional Chinese medicine is one of the reasons why authentic traditional Chinese medicine practitioners are not being properly cultivated. The third big issue is about creating textbooks for traditional Chinese medicine education, and you have to decide which approach to take. One option is to use classical texts directly as textbooks, like the Shanghanluan and the Huangdi Neijing 3rd century CE. These are considered classics, so why not use them as textbooks? The other option is to have modern scholars write the textbooks. Currently, the textbooks we see in traditional Chinese medicine universities have three main criteria. They provide systematic knowledge, standardized concepts, and modern language expression. Now, when we compare these textbooks to using classical traditional Chinese medicine texts as teaching materials, what choice should we make? In my opinion, traditional Chinese medicine textbooks should only be based on classical texts and should not be compiled based on the theories of modern scholars. It just doesn't work. You can use modern textbooks, but first, you have to read the classics before diving into the modern ones. You can't do it the other way around. If you start by reading modern traditional Chinese medicine textbooks and then try to understand the classics, you'll struggle. I've expressed this viewpoint many times. When I was invited to discuss traditional Chinese medicine issues at Shanghai University of Traditional Chinese Medicine, I made it clear that when compiling textbooks, we can create new ones, but what's the prerequisite? It should be based on the classics. The textbooks should provide appropriate explanations and interpretations of the classics, rather than being a self-composed set of standardized concepts expressed in modern language. That approach won't work. Classical Chinese is meant to be experienced as classical Chinese. Can you understand the Huangdi Neijing? How deeply can you grasp the Shang Hanluan? It all depends on your foundation of traditional Chinese medicine theory, which is based on the classics, not modern textbooks. You can read the modern ones to gain some insights because they have made some research progress, but what's the prerequisite? You have to read the classics first. You can't do it the other way around. If you reverse the order, you won't understand the classics. This is the third major issue. The fourth major issue in traditional Chinese medicine is the choice of clinical practice models. There are 6 different models to consider, and I'll explain each one in detail so that you can easily understand them. The first model is focused on treating diseases in traditional Chinese medicine clinical practice. It involves creating personalized treatment plans based on the principles of syndrome differentiation and treatment. Let's say we have 2 patients with the same diagnosed disease. Despite having the same disease, their prescribed herbal formulas will be different. Traditional Chinese medicine places great importance on individualized treatment because everyone's innate constitution varies greatly. For example, some people naturally have a hot constitution, while others have a cold constitution. Using the same medicine for the same disease won't be effective in these cases. This model relies on syndrome differentiation and treatment to provide tailored treatment plans. The second model is symptomatic treatment, which emphasizes the importance of addressing symptoms. Symptoms refer to the manifestations of the disease. Traditional Chinese medicine offers numerous herbal formulas that directly target symptoms rather than the underlying causes. While this approach can be effective, it deviates from the principles of syndrome differentiation and treatment. The third model is empirical formula treatment, particularly the use of ancestral empirical formulas. These formulas are developed solely based on accumulated experience. Some traditional Chinese medicine practitioners have gained fame by relying exclusively on these ancestral empirical formulas to treat diseases. This model is based on the clinical practice of using formulas that have been passed down through generations. The fourth model is specialized treatment for specific diseases using specific formulas. In this model, patients are categorized into different specialties based on their diseases. Once the disease is identified, a specific formula is already prepared for it. Sometimes, when I visit a traditional Chinese medicine hospital for treatment, I notice that they prescribe a standardized formula without even taking my pulse. They already know my disease and have a ready-made formula for it. This is known as specialized formula treatment. Many traditional Chinese medicine hospitals now adopt this clinical practice model. A true traditional Chinese medicine practitioner should be well-rounded, but nowadays, traditional Chinese medicine has been divided into different specialties and subspecialties. What has to happen? It will certainly lead to traditional Chinese medicine's decline. It seems like traditional Chinese medicine is trying to be more like Western medicine by imitating their specialization and disease-specific treatment approach. Is traditional Chinese medicine moving closer to Western medicine? When I shared this idea, it faced opposition in Shanghai. Professor Wang, What are your thoughts on how traditional Chinese medicine hospitals should be structured? Should we get rid of all these specialized departments? Your response is eagerly awaited. The fifth way traditional Chinese medicine is practiced is by using powerful herbal formulas, and we can't just dismiss it altogether. Over the course of traditional Chinese medicine's history, many of these potent formulas have been developed, and we have to be honest about that. But if we only rely on these formulas without considering the unique needs of each patient, it won't work for everyone. When dealing with serious and complex illnesses, it's not right to just throw potent formulas at every disease without considering the individual situation. There's another way of practicing medicine that combines Western medicine's understanding of diseases with the use of traditional Chinese medicine remedies. We rely on Western medicine's pathology to diagnose and classify diseases, and then, as traditional Chinese medicine practitioners, we apply traditional Chinese medicine remedies to treat these diseases. For example, if Western medicine diagnoses a disease as cancer, that concept belongs to Western medicine. Traditional Chinese medicine doesn't have the same concept of cancer. So when traditional Chinese medicine and Western medicine are integrated, we often use Western medicine's disease classification system, known as pathology, as the basis. Then we use traditional Chinese medicine remedies to treat the disease, which is called the integration of traditional Chinese medicine and Western medicine, or disease differentiation. The foundation of disease differentiation is based on Western medicine. For instance, if you have hepatitis, whether it's hepatitis A, B, or C, that concept comes from Western medicine, not traditional Chinese medicine. In traditional Chinese medicine's perspective, there's no specific disease called hepatitis. Instead, it's seen as a syndrome characterized by dampness and heat. However, nowadays, traditional Chinese medicine has also incorporated Western medicine's pathology and accepted its disease classification and nature for disease differentiation. We use Western medicine's pathology to differentiate diseases and then use traditional Chinese medicine, herbal medicine, to treat them. This is the approach followed by many hospitals that integrate traditional Chinese medicine and Western medicine today. So, some traditional Chinese medicine hospitals claim that they have a special knack for treating cancer. So I ask them, do you guys even recognize cancer as a disease in traditional Chinese medicine? Nope, they don't. If someone with a cancer diagnosis from a Western doctor goes to a traditional Chinese medicine practitioner, a true traditional Chinese medicine practitioner won't care about that diagnosis. They'll be like, "Don't tell me what disease you have. Let's see what's going on with you." They'll figure it out themselves and diagnose accordingly. But they'll use traditional Chinese medicine, herbal medicine, to treat the condition they identify, and if it works well, they'll get praised. People will be like, "Wow, your hospital is amazing. This doctor is a cancer-fighting genius." But traditional Chinese medicine practitioners shouldn't be proud of that. They should say, "I don't know about cancer," and that would be the right thing to say. They only treat what they can identify. So, here are 6 different clinical practice approaches, and choosing the right one is all about defending the purity of traditional Chinese medicine. If we can't do that, traditional Chinese medicine will slowly fade away and eventually be swallowed up by Western medicine. The 5th big question is, how do we actually use the ancient prescriptions from famous doctors in traditional Chinese medicine? Traditional Chinese medicine has a rich history and has gathered a treasure trove of prescriptions from renowned doctors over the years. It's important to value and preserve this heritage. But the real challenge is how to put them into practice. There are 2 main approaches. One is to simply follow these prescriptions without making any changes, just because they come from famous doctors. The other approach is to respect these prescriptions but study them using the principles of compatibility and modification. The prescriptions from famous doctors throughout history are meant to be learned from, not blindly copied. These are two different ways of doing things. By studying the theories of compatibility in traditional Chinese medicine, we can learn from these prescriptions and adapt them flexibly to suit the needs of different patients. I've put forward this idea, and the traditional Chinese medicine community agrees with it wholeheartedly. However, some friends have confided in me that in practice, many traditional Chinese medicine practitioners struggle to adapt and mostly stick to fixed routines. This has made me worried about the future of traditional Chinese medicine. The sixth big question is, how do we decide how much Chinese herbal medicine to use? In China, we have a modern pharmacopoeia specifically for Chinese herbal medicine. It gives us guidelines on how much of each medicine to use in clinical practice. But here's the thing, are these guidelines actually reasonable? And should we blindly follow them? Some healthcare practitioners might choose to stick to these guidelines to avoid any trouble or legal issues. But deep down, they know that these standardized dosages might not always be the best option. Individualized treatment is still crucial. To summarize, these are the topics that I first put forward for discussion, which are the 6 major issues being discussed in the field of traditional Chinese medicine. What is traditional Chinese medicine? Is it philosophical medicine or empirical medicine? How to train physicians? What should be the teaching methods? How should textbooks be written? What should be the mode of clinical practice? These are the 6 major issues. To further address these 6 major issues, what do we rely on? We will need an understanding of the philosophical foundation of traditional Chinese medicine to make any judgment.